Chapter 17, The Toddler. Toddler is between 1 to 3 years of age. No, they are no longer completely dependent on others, and then the rapid and growth development that happened during the infancy from birth to 1 year now starts to slow down. For Erickson's stage, this is now the autonomy versus shame and doubt. For infancy, remember that's trust versus mistrust. For physical development, the birth weight will quadruple by the age of 2.5 years of age. And those growth and development that happens rapidly during infancy will now starts to slow down. Like the rate of the brain growth will slow, the body proportion will change, the head and the trunk will grow more slowly. The musculoskeletal that was rapidly growing in a linear pattern during infancy will also now slow down, and then the bones will begin to ossify. The protuberant abdomen will flatten when muscle fibers increase in size and strength. Myelinization of the spinal cord will nearly be complete by age of the 2 years. Myelinization of spinal cord, if you recall, this is to help with the smoothen the transmission from one nerve to the next nerve. Myelinization is helping with the transmission of those nerve impulses, and this happens and usually gets completed by the age of 2 years. Bowel and bladder control usually complete by 2.5 to 3 years of age. The respiration, they still mainly abdominal, but will shift to thoracic as the child reaches the school age. They should be able to or capable of maintaining stable body temperature. The eruption of the deciduous teeth, which is the baby teeth, will complete or be completed by 2.5 years. The defense mechanism of the skin and blood are also now more effective. Digestive processes and stomach capacity will increase to allow 3 meals a day. The senses and the motor abilities of a toddler do not function independently. They use their eyes to reach, grasp, inspect, smell, taste, and study objects. The binocular vision is well established by 15 months, and their visual acuity is like 20/40 by 2 years of age. Memory will strengthen, and they are able to assimilate information through trial, error, and repetition. The speech development of a toddler parallels the cognitive growth, which means that the more that they grow cognitively, then the more that the language development will also grow. Their comprehension will exceed verbalization. Expressive and receptive language continue to develop. Expressive is when, of course, they're trying to express something, and then receptive is when they are actually trying to communicate and understand what they are being told to. If you look at that language milestone table in page 415, table 17.2, it talks about the milestone for expressive and receptive language from age 1 month to 36 months, and it's very helpful. So read and understand this table. Then when a toddler is also communicating, for example, they will refer animals by the sound that the animal will make. Like for example, they might call a cat meow meow, right? Or the dog will be ow ow, like that, instead of calling them dog or a cat. And then around this time also is that they will have those speech or language that they will say bye bye or mama or dada. And the response to those words that they say, they actually will be happy if the person that they're talking to will show empathy or will actually respond to that tone of voice, and they will show like very nice like facial expressions. So if a toddler is talking to a parent, for example, and say mama, and then the mother will respond with a smile, then that's when they will be like, oh, okay, so I will keep saying it, right? So respond to tone of voice and facial expressions of those around them is very important. And showing empathy toward the toddler who is trying to communicate verbally will help minimize frustrations. And that's why sometimes there will be toddlers that when they're trying to communicate and then the adult cannot understand them, they become frustrated. So as the adult, as the nurse, as the parent, then we also will try to communicate to them that shows empathy, and be patient, and then give them enough time so that they can communicate positively to the adult. Screening for signs of autism, we have preliminary symptoms that may include no pointing and gesturing by the end of 12 months, gesturing including like those bye bye, like like putting their or waving their hands when they're trying to say bye bye. No single words by age 16 months, and no spontaneous two-word phrases by 24 months. And then there's a loss of achieved language or social skills. So when these preliminary symptoms are seen in a toddler, then that's when we kind of like do more screening, to see if there's like autism that is going on. Important to rule out lead poisoning, hearing deficit, and neurological disorders, because there will be toddlers that will be delayed with the communicating, or communication skills, and that's because maybe something else is going on, like hearing deficit, for example. So we want to rule out all of those other things first, and then we do the screening. Musculoskeletal diseases too and inborn errors of metabolism can also cause these symptoms right here. For guidance and discipline, the goal for a toddler is to teach, not to punish. When we discipline them with guidance. The responses to temper tantrums, they can either reinforce the desirability of or the risks involved in such behavior. So when the toddler is throwing the temper tantrum, it's very important to know how the parent respond to it. Is the parent smiling, laughing, or giving them positive feedback when they're giving this temper tantrum? Then obviously it's time to intervene and educate them and say, this behavior needs guidance and discipline, and we should not be encouraging it. However, it's also very important to talk to the parents and tell them that when you educate, then you discipline them, you don't punish, right? And then it's very important that even though this is toddlers that you're talking to, then you're gonna try to still help them understand like what is wrong and what is right. Expectations must be in line with the child's physical and cognitive abilities, like limit setting and timeouts. And this is why when we do timeout for toddlers, we limit them on the every year of the toddler is how many minutes that you do the timeout. For example, you have a 4-year-old child and you are actually giving them a timeout for something that they did, then you're gonna give them 4 minutes, right? For every year, there is 1 minute, okay? Another example is if you're talking to a 3-year-old child, right? And you're actually going to give them a timeout, then you're gonna give them for 3 minutes. Page 417, table 17.4 is behavior problems during early childhood. what are the normal expectations, and what are parental guidance. Please read through this table and then highlight those important things and remember them. Daily care. The adults should be at eye level when talking to a toddler. What we do is, like I said, if we're trying to discipline and give guidance to a toddler, we do not look down to them, because the goal is not to punish, the goal is to teach. So you go down, maybe kneel or sit down where you are the eye level of the toddler when you're talking to them. And when you do that, it seems less overwhelming for the child. Flexible schedule organized around needs of the entire household is best. You do not want to have a toddler and then everybody else is busy in the household. There will still need for that flexible schedule that we organize around the needs of the child. Clothing should be easily put on and removed, and then we make sure that those toddlers are also protected from the sunburn protection. Toilet independence. Much depends on temperament of the toddler and the person guiding toilet training. So obviously, if the toddler and the person that is actually doing the toilet training are both frustrated, then it's not gonna work, right? So there's always going to be a balance. The toddler needs to have a person that has that the desire to teach and the desire to be patient and the desire to train. Okay. Voluntary control of the anal and the urethral sphincters begins around 18 to 24 months of age. And why is this very important to know? It's very important to remember so that you can actually educate the parents that they cannot be starting the toilet training before the 18 months, right? They should be waiting for this 18 to 24 months, because this is when the control of those sphincters actually starts to be voluntary control. So it will be easier for the child and the person that is doing the toilet training if we do it between 18 to 24 months of age. The caloric needs will now start to decline to about 100 calories per kilogram per day. And then they limit the milk intake now to more than 24 ounces per day. So because the infant during the infancy, right, they depend on the milk, and then you start to kind of like wean them down once the infant starts eating solid food, which is around 6 to 9 months of age, right? That's when we start introducing the 6 months, that's the solid food. And then serving size is 1 tablespoon of solid food per year of age. So why is this important to know? It's important to know that the serving size actually is just 1 tablespoon of solid food per the year of age. So meaning if you have like a 3-year old, right, you would want a serving size that is like 3 tablespoon of solid food. You do not want to be giving them too much or be giving them too little. Food should be chopped into fine pieces, and various foods are offered. Toddlers prefer finger foods, and this is why you will meet toddlers that will want those chicken tenders, chicken nuggets, those finger foods, because they love to be always on the go. That's why they love finger foods. The picky eater versus a feeding disorder. How do we know when it's a picky eater, or how do we know if it's actually a feeding disorder? Picky eater, selective about food color, taste, texture, or smell, but they will eat to maintain their growth and development. The feeding disorder, this is when they actually refuse to eat to maintain growth and development. It can lead to weight loss and then developmental delays, and that's the difference between the two. Okay. Daycare must meet the family's personal preferences, cultural perspectives, and financial and special needs, and should be state approved. The best injury prevention is knowledge of age appropriate risk and anticipatory guidelines, and the parents will need to understand their child's activities at certain ages in order to prevent injuries by taking appropriate precautions. For example, the toddlers, they are curious, they are mobile. They would love to explore their environment. So, one, they're at risk for, let's say, poisoning, for example, right? Because they might see like some chemicals that is just laying around there, and then they will try to like taste it or eat it. Okay, that's one. Another thing, like we said, toddlers are curious and mobile. They're at high risk also for falls, right? Because they love to run around, they love to climb. Um, so they're exploring their environment, so they're at risk for falls. So, what are those things that we can do to do injury prevention? If you go to page 421, that table over there, which has a title of How to Prevent Hazards Caused by the Behavioral Characteristics of Toddlers. Very helpful. Please read that table in 421 up until 422. The federal government and private organizations regulate variables to prevent injuries, so they try to actually have these regulations to prevent the injuries, like non-flammable sleepwear, child-proof caps, right, on medicine bottles, and like those chemicals also, like soap or detergent, laundry detergent, right? They have those child-proof caps now. Maximum temperatures for water heaters, smoke and carbon monoxide detectors, slat space in infant cribs, and car seats. For the car seat, they begin with the first ride home from the hospital, right? And then the car seat should be rear facing for children up to 2 years of age. And then they should have a 5-point restraint harness. A booster seat, they can be used when the child outgrows the car seat, and after the child is large enough for a car safety belt to fit correctly, usually around like heavier than 80 pounds and taller than 57 inches, then a shoulder and lap belt system is can be used. Please remember that if we use the safety belts and the car seat incorrectly, it can cause injury to a child. Toys and the play. Parents must be taught to inspect the toys and to buy toys suitable to the age, skills, and abilities of their child. Those toys that will have those small parts, we have to be very careful when we're taking care of toddlers, because they may still, put it in their mouth, and they may still aspirate and choke from it. Play is the work of toddlers. This is also how they um, explore their environment. This is how they understand and grow their comprehension through play. Okay, they learn how to manipulate and understand their environment, socialize, and explore their world.